Most smokers know they are at risk for lung disease and heart disease, but few know they are damaging the most important artery in the body, the aorta. In fact, most patients have little to no warning signs that pressure is building and causing a very serious condition, an abdominal aortic aneurysm.
Ruptured aneurysm is absolutely a devastating complication of aneurysm disease. About half of patients who suffer rupture of their aneurysm will die before the emergency medical system ever gets there.
Born and raised in the Pocono Mountains, 67-year-old Lee Shupp had to give his doctor an answer to a simple question. At this stage in his life, what was he most looking forward to?
I said my main goal is to watch my 4 grandsons grow up, you know, get big, see what they do. Well, I'm going to tell you a little story. If you don't quit smoking, you're not going to see that.
That's because smoking is one of the highest risk factors for an abdominal aortic aneurysm. Every year in the United States, approximately 200,000 people are diagnosed with an abdominal aortic aneurysm.
Well, an abdominal aortic aneurysm is basically a blistering of the abdominal aorta, which is the main body, the main pipeline, essentially, of blood flow in the body.
When a weak area of the abdominal aorta expands or bulges, the result is an abdominal aortic aneurysm.
The analogy I like to think of is like an old tire that gets a weak spot in it and bubbles out. And like a ballooning, if the balloon gets stretched too big, it will burst.
It was at the point, it was just like somebody was in there with a knife. And I mean just daggering, I mean just twisting. I never had pain like that in my life, never.
Once an aneurysm is detected, patients may be screened as often as every 6 months to check the rate of its growth. The size is the strongest indicator of when an aneurysm is at risk for rupture and is also critically important in determining when surgical repair is necessary. In the last 10 years, a new procedure has been developed for the treatment of abdominal aortic aneurysms, using a minimally invasive approach called EVAR, or endovascular aneurysm repair. Its purpose is to relieve the pressure on the aneurysm walls, protecting it from rupture, while keeping the blood within the aneurysm walls flowing freely.
We make small incisions in the groin and access the main artery. Then we travel up inside the aneurysm with a catheter that contains a device to repair the aneurysm and places a sleeve or a liner inside the aneurysm so that pressure of blood is no longer transmitted to the aneurysm wall, but rather is now carried by this device.
So far, this procedure has had a lot of success and often creates a quicker path to patient recovery.
Luckily, the Lord was with me, I guess. I made it. I want to be able to enjoy myself in the next couple of years, you know. Enjoy my 4-wheeler. To me, that's my enjoyment. And it's something that I've been doing with my grandchildren.
Many people are still unaware of this life-threatening condition. Experts hope a renewed emphasis on screening and early diagnosis can help turn a corner in combating the often devastating effects of abdominal aortic aneurysms.